This is a CJSON podcast. I'm Dr. Zhong Zheng, nephrologist from the New York University Grossman School of Medicine. I'm excited to present our study titled Association of Estimated Glomerular Filtration Rate and Albuminuria with Venous Thromboembolism on behalf of our co-authors. In our study, we looked at venous thromboembolism, a condition that includes deep vein thrombosis and pulmonary embolism. It has been associated with substantial morbidity and mortality. We analyzed data from nearly 24,000 adults hospitalized in the Geisinger Health System from 2004 to 2019, and over 11,000 hospitalized in NYU Langone between 2012 and 2022. Around half the patients in both systems were women, and the average age in both was around 66 years. We tried to understand how kidney function, GFR, and albuminuria in hospitalized patients were associated with the risk of subsequent venous thromboembolism. So, after adjusting for traditional risk factors for venous thromboembolism and use of medications including anticoagulants, we found that lower GFR, or below 60 ml per minute, and higher levels of albuminuria were independently associated with a greater risk of venous thromboembolism. We had very similar findings in both cohorts. These findings expand on prior knowledge, especially in people with advanced chronic kidney disease stages where there was little previous data, and introduce low eGFR and higher albuminuria as risk factors for venous thromboembolism after hospitalization. To conclude, individuals with lower estimated glomerular filtration rate and higher albuminuria face a higher risk of venous thromboembolism after hospitalization, particularly with advanced chronic kidney disease.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.